I've always tried to take care of myself, so I was surprised recently when my doctor told me I had postmenopausal osteoporosis.
I have very painful memories of my mother suffering from osteoporosis and associated complications. The toughest thing for her and for me was watching her strength vanish little by little. Eventually, she had to rely on the people that she had always taken care of. Seeing her lose her independence was hard. It made me decide that I would do everything I could to avoid that same fate.
Many women are concerned about osteoporosis, and for good reason. Postmenopausal osteoporosis is certainly not uncommon. In fact, approximately 28 million Americans have or are at risk for developing osteoporosis. It's also quite serious. Every year, roughly 1.5 million Americans suffer osteoporosis-related falls and fractures.
All right, ready?
But as you know, osteoporosis can be treated. I'd like to congratulate you for seeing your healthcare provider and determining with him or her that miacalcin nasal spray is the right treatment for you. In this program, we'll explore what osteoporosis does to our bones and why it's dangerous. We'll explore how miacalcin nasal spray, exercise, and diet combine to help increase bone mineral density. And at the conclusion of the program, I'll demonstrate how to assemble and use miacalcin nasal spray.
When I was a girl, I remember looking at my grandmother and noticing how bent over she was. Then I looked at other women her age. They all had the same stooped posture. Then I thought, this must be what happens when you get older.
My mother wasn't the only one. My grandmother and two of my aunts also had osteoporosis. It's so common. I used to think it was a normal part of aging.
Osteoporosis may be common, but that does not make it a normal part of aging. Most experts describe it as a condition or disorder in which the rate of bone loss exceeds the rate of bone formation and may result in an increased risk of fracture. In fact, the term osteoporosis literally means porous bone. Osteoporosis has also been called the silent disease because women generally have the condition for years without knowing it. Then, unexpectedly, a minor injury, a strain or fall, causes a severely weakened bone to break. Patients often ask, what causes osteoporosis, and why do women get it more than men? To answer this question, you really have to begin with a description of how our bones grow. When we look at a magnified view of the inside of a bone, we see that it looks like a honeycomb. A closer look reveals two cell types that control the size and shape of our skeleton. These are the bone-making cells and the bone-dissolving cells. The actions of these cells make it possible for broken bones to heal. They also enable bones to get stronger in response to exercise. In addition, because the skeleton stores 99% of the calcium in our bodies, these cells help regulate the calcium our bodies need every day. As we grow, the bone-making cells do more of the work, and the total size and weight of our skeleton, also known as our bone mass, increases. Most of us reach our peak bone mass at about age 35. After that, our bone mass begins to decrease gradually. In women, menopause speeds up the process of bone loss. This is because a woman's body produces substantially less estrogen, one of the hormones that helps maintain healthy bones. These pictures tell the story. The first is a microscopic view of normal, healthy bone. The other reveals an advanced stage of osteoporosis. It's easy to see how fragile bones can become. In fact, Simply the weight of our own body can cause osteoporotic bones of the spine to fracture and collapse downward. When this compression occurs, a person literally gets shorter and the spine curves forward. These breaks are called compression fractures. As the spine gets compressed, the rib cage gets lower. When this happens, a woman may notice that her figure has changed to the point that she no longer has a waist. This change in body shape leaves less room for the lungs and can make breathing more difficult.
Some of my friends were surprised when I told them that I was taking medication for osteoporosis. They thought that only women in their 70s and 80s got osteoporosis.
There are many misconceptions about osteoporosis. So, in discussing medication, diet, and exercise, let's try to separate fact from fiction. One false belief is that taking estrogen is the only way to treat osteoporosis. That's simply incorrect. It is true that estrogen replacement therapy is effective in the prevention and treatment of postmenopausal osteoporosis. However, many women can't take estrogen therapy or are unwilling to take estrogens because of concerns about cancer risks and side effects. Fortunately, miacalcin nasal spray is an excellent alternative to estrogen for treating postmenopausal osteoporosis. Miacalcin nasal spray is indicated for the treatment of postmenopausal osteoporosis in women who are more than 5 years after menopause, who have low bone mass, who refuse or cannot tolerate estrogen, or for whom estrogens are not an option. Patients should also ensure adequate intake of calcium and vitamin D. The active ingredient in miacalcin nasal spray is salmon calcitonin, a naturally occurring hormone that works by blocking the action of the bone-dissolving cells. This helps to slow the loss of bone mass. Miacalcin as a nasal spray has been used to treat osteoporosis in over 70 countries around the world over 12 years. It's easy to use, and studies show that it significantly increases bone mineral density. As with any medication, you may experience side effects when using miacalcin nasal spray. These side effects may include nasal symptoms, such as a runny nose or a nosebleed, back and or joint pain, and headache. These side effects tend to be mild and disappear quickly, but in some cases, your healthcare provider may recommend that you temporarily stop taking the medication until symptoms subside. In the event that you experience any side effects from miacalcin nasal spray, be sure to contact your healthcare provider. Also, because calcitonin salmon, the active ingredient in miacalcin nasal spray, is a protein, the potential for a systemic allergic reaction exists. Patients who are allergic to calcitonin salmon should not use miacalcin nasal spray. Of course, getting the prescription is only the first step. For best results, you must make a habit of taking miacalcin nasal spray on a daily basis.
Taking miacalcin nasal spray was no problem for me because what I did is I put it right near my toothpaste and toothbrush. And so then, when I got up in the morning, I took one puff of miacalcin nasal spray, brushed my teeth, and that was it.
Miacalcin nasal spray can be taken anytime, anywhere, with or without food. In general, placing the spray bottle in a location where you will see it the same time every day, near your toothbrush, for example, is a good automatic reminder. Think about your lifestyle and daily habits and pick a location that works for you. Remember, you must spray miacalcin nasal spray in alternate nostrils. One day you spray it in the left nostril, the next day in the right nostril, and so on. The role of calcium and vitamin D are also the source of some confusion. Let's consider why calcium is so important. As I mentioned, the skeleton holds most of the calcium in our bodies. However, in order for our nerves and muscles to work properly, we need to have a small amount of calcium circulating in our bloodstream. If we don't get enough calcium from the foods we eat, then our bloodstream takes the calcium it needs by dissolving it out of the skeleton. Both the National Institute of Health and the National Osteoporosis Foundation recommend that healthy postmenopausal women have at least 1,500 milligrams of calcium a day. This is an adequate amount of calcium to take while you're using miacalcin nasal spray. A safe way to ensure that you're getting enough calcium is by taking supplements. This topic is important to discuss with your doctor, as you may already be consuming an adequate amount of calcium in your diet. For example, 3 8-ounce glasses of skim milk contain about 1,000 milligrams of calcium. Other foods rich in calcium include yogurt, cheese, sardines, broccoli, collards, and watercress. Remember that the amount of calcium in certain products is highly variable, so it's important to talk with your healthcare provider or dietitian about the best sources of dietary calcium for you. Vitamin D supplements are also an important part of the picture because vitamin D helps the body absorb calcium. The recommended daily amount is 400 international units, or IUs, a day. This is the amount of vitamin D you should consume daily. As with any medication, consult your doctor regarding the proper amount of vitamin D for you.
Well, my garden is important to me, and there was no way I was able to get out in the garden before because of my osteoporosis. One day I said, I don't care, I'm going out there. I'm going to work in the garden. And so I'm out there pulling out the big weeds and pretty soon the little weeds. And before I realized, I had actually cleaned the entire garden.
It's natural for a person with osteoporosis to be concerned about falling because of the increased risk of breaking a bone. However, sitting home, becoming a couch potato, and avoiding all types of activity is not the answer. The best solution is to talk with your healthcare provider about exercise to find out what is best for you. In general, weight-bearing exercise is recommended for people with osteoporosis. By weight-bearing, we mean exercise that forces you to work against gravity. This type of exertion has a positive effect on our bones. It also helps improve balance and coordination. Activities like walking, tennis, jogging, stair climbing, dancing, and hiking are best. Non-weight-bearing sports like swimming or bike riding are also good for our overall health, but they don't have the same benefits with regard to osteoporosis. Remember, it's always important to speak with your healthcare provider before starting any new type of exercise program.
When I was introduced to miacalcin nasal spray, I was shown that you just spray in one nostril one day and spray in the other nostril the following day. It's so simple to use. I couldn't believe it.
We've spoken about the roles of medication, calcium, vitamin D, and exercise in treating osteoporosis. Let's return to the topic of medication to see how to use your miacalcin nasal spray. You start by assembling the nasal spray unit. This is the bottle that contains the medicine, and this is the pump. To begin, pull the tab and carefully remove the metal safety seal on the cap of the bottle. Then, keeping the bottle upright, remove the rubber stopper from the bottle. Now, set that down. Let's move on to the pump unit. Holding the pump unit, gently remove the opaque plastic protective cap from the bottom of the unit. Now you want to insert the pump unit into the bottle and turn the pump clockwise to tighten. Then, holding the bottle upright with your index finger on one of the two side arms of the pump, like this, gently remove the clear protective cap from the top of the nozzle. Before taking a first dose, you need to activate the pump. To do this, hold the bottle upright with your thumb on the bottom of the bottle and your index and middle fingers on these two side arms. Pump the bottle 6 times until a faint spray is emitted. It's easier to see the spray if you hold the bottle up to the light. It's essential that you activate the pump prior to its first use. If you fail to do so, you will not receive the correct amount of medication. Don't worry about wasting the medication when you activate the pump. There is enough medication in the vial to assure that you receive 14 doses after activation. Once you activate the pump, you are ready to take the first dose. With your head upright, insert the nozzle firmly into your nostril and press the pump down onto the bottle. A single spray in one nostril is the daily dose, and you should alternate nostrils from day to day. Before you open a bottle, it should be stored in a refrigerator but never in a freezer. Once you activate the pump and start taking miacalcin nasal spray daily, it can be kept at room temperature.
The spray is so easy to use. It's much better than taking pills as far as I'm concerned. I don't know what I would do without miacalcin nasal spray. It's great.
Some people resent having to take medicine. I don't. If medicine can help keep me strong as I grow older, then it's not a burden. It's a blessing.
Your healthcare provider got you started on miacalcin nasal spray for a reason, to treat your postmenopausal osteoporosis. By taking your medicine in alternate nostrils every day, or as directed by your healthcare provider, and by making sure that you get adequate amounts of calcium and vitamin D and exercise regularly, you are doing everything possible for your condition. It's important that you take your medicine every day as instructed by your healthcare provider. Failure to do so could result in your losing the benefits of your miacalcin nasal spray therapy. We hope that this review of osteoporosis and its treatment, and our demonstration of how to use miacalcin nasal spray, have been helpful. For more information about miacalcin nasal spray, contact your healthcare provider. This program has been brought to you by Novartis Pharmaceuticals Corporation.